Hello, student. Good morning. As we are just studying in the civics about the healthcare, the role of the health, and the role of the government in the health sector. So we were discussing about these all things, and we have read one of the this one conversation between two friends. Okay, one belongs from the prosperous family, one belongs from the poor family. Then after this one, we have discussed about the public and private health services. So one by one, we will understand what is public health service and what is private health services. Okay, the first they have shown here public health services. The public health service is a chain of health centers and hospitals run by the government. Means all the public health services. It is a chain of the health centers, mainly in this one, health centers, clinic, hospitals will be there, and which are mainly governed and ruled by the government and run by the government. They are linked together so that they cover both rural and urban areas and can also provide treatment to all kinds of problems from common illness to special services. So what about the hospitals and health centers which are running by the government? So what they are linked with each other, they are linked together, and they cover both, whether that is rural areas or the urban areas, and they can also provide the treatment from the simple one, like if you suffer from any common illness, common injuries, from there to the special services. At the village level, there are health centers where there is usually a nurse and a village health worker. In the rural areas, mainly at the village area, they have shown. So what used to happen, which sort of the health centers are there, where you will find usually a nurse, okay, and as you all know that the compounders, okay, and these people are there, and a village health worker you will also find over there. They are trained in dealing with common illness and work under the supervision of doctors at the primary health center, that is PHC. So these nurses and the particular village health worker, they are well trained. Okay, they are well trained in dealing with the common illness. If common injuries and illness will be there, they are well trained to deal with this one, and they work under the supervision of doctors, and they also work under the supervision, under the observation of the doctor, which are nearby in the primary health center. Such a center covers many villages in the rural areas. This PHC, Primary Health Center, it covers many villages in the rural areas. At the district level is the district hospital that also supervises all the health centers. As you all know that in a district, one district hospital is run by the government, which means like the common with the common treatment to special treatment, which you can get in these district hospitals, and these are also supervises all the health centers within the district. Large cities have many government hospitals, such as the one where Aman was taken, and also specialized government hospitals, such as ones in Hakim Sheikh's story. So in the large cities, they have told there are many government hospitals in the metropolitan cities, mainly in the large cities where the population is quite more. So in this one, more than one, you will find many government hospitals will be there. As we have taken the example, we have read the example in the same chapter about the Aman, and in the previous chapter we have read the example of the Hakim Sheikh. Okay, then the health services is called public for many regions. The health services is called public for many regions. Why? That has been given. That has been also given downside. What is it? That is, in order to fulfill its commitment of providing health care to all citizens, the government has established these hospitals and health centers. So here they have shown. So in order to provide the good health care services to all the citizens, so the government has established these hospitals and health centers. So it is the duty of the government to provide good health services and good health care to all the citizens of the country. Okay. Then after this one, also the resources needed to run these services are obtained from the money that we, the public, pay to the government as tax. As you all know that for running something, so we need some that is currency. Yeah, we need some money in our hand. So that is why, so whatever the we people pay the taxes, we the public, with the people, whatever the taxes is being paid by us. So with the help of this one, the government obtain the money from us and for running this one. So whatever the resources, whatever the things are needed for running the hospitals, doctors, nurses, other that is health staff, and as well as other that is different kind of the that machines for checking up, for just making the treatment. So these all the things the government purchase from this money. Okay. Then what they have given here, hence such facilities are meant for everyone. So whatever the facilities are given by any hospital, government hospital, these are for everyone. One of the most important aspect of the public health system is that it is meant to provide quality health care services either free or at a low cost so that even the poor can seek treatment. So one of the key that is most key feature of the that is about the government hospitals, that mean to say it provide a good quality health care either free or at a low cost, very means nominal cost will be there, so that even the poor can afford this treatment. Okay. Another important function of the public health is to take action to prevent the spread of diseases such as TB, malaria, jaundice, and cholera. Here that has been also shown that another important function, the work of the public health centers to take action, to take initiatives to prevent, to remove the spread of the diseases such as tuberculosis, malaria, jaundice, cholera, diarrhea, chikungunya, etc. Okay, whatever these diseases are there, it is also the duty of the government hospitals to take action against of these diseases. This has to be organized by the government with the participation of people, otherwise it is not effective. So this has to be organized by the government. These all the things organized by the government, must organize by the government with the participation of people, otherwise it is not effective. So we people also take initiatives for organizing these services which is given and which is just run by the government. For example, when taking up a campaign to see the mosquitoes do not breed in water coolers, rooftops, etc., this has to be done for all the houses in the area. For example, they have shown here that about the mosquitoes. When that is, for example, they have shown here when taking up a campaign to see the mosquito do not breed in the water coolers. The mosquito it could not breed in the water coolers, rooftop, rooftops, etc. So this has to be done in all the houses in the area. Recall the case of Hakim Sheikh. Would you like to know what the court said in this case? As in this one, we have read one stories about the Hakim Sheikh. He got head injury, and many of the hospitals they didn't provide the this one treatment that is sudden treatment to him. So after this one, what happened to his case? The that has been given here. Okay, according to the constitution, it is the primary duty of the government to ensure, to make sure the welfare of the people and provide health care facilities to all. So according to the provisions, whatever the provisions have been written in the constitution, so it is the primary duty, main duty of the government to make sure the welfare of the people, means to give to think about the welfare of the citizens and provide the health care facilities to all. Then the government must safeguard the right to life of every person. So here it is the duty of the government, it must safeguard the right to life of every person in the country. The court said that the difficulty that Hakim Sheikh had to face could have cost him his life. Okay, as they have just appealed, they have just filed a case in the court. So what happened after this one? The court said that the difficulty that Hakim Sheikh had to face could have cost him his life. His life would have been lost by him. If a hospital cannot provide timely medical treatment to a person, it means that this protection of life is not being given. Then it's just cleared by the court. If any hospital is unable to provide, not able to provide the medical treatment to any person who got injuries, so it means that the protection of that life of that particular person's life is not being given. The court also said that it was the duty of government to provide the necessary health services including treatment in emergency situation. So the code also given there the order to the government. It said it is the duty of the government to provide, it is the responsibility and duty of the government to provide the necessary health services including treatment in emergency situation. Hospitals and medical staff must fulfill their duties to provide the necessary treatment, and as well as it has been stated by the court. So it is the duty of the hospital and medical staff to provide the necessary treatment to particular injured person. As here, if you take the example of Hakim Sheikh was denied treatment at various government hospitals. He didn't get, as he had went more than many of the hospitals, more than 8 hospitals, government hospital, but he didn't get the treatment. So what happened? Therefore, the court asked the state government to give him the money that he had spent on his treatment. Then the court gave the order and asked to the state government to give the compensation, mainly the money, to that person, whatever he spent uh, for his treatment. Okay, so this is the case about this one. So we have read and how the public health services that works. Now here they have given about the private health facilities, which we will talk in the next video. Okay.